Jake.
visible.
Go ahead.
Okay. All right. Well, welcome to our virtual open house. Thanks so much for joining us this evening. We're really excited to kick off this year's recruitment season and to showcase our program. Tonight's agenda includes introductions of our panelists, a brief informational presentation about our program, and what it's like being a resident in Iowa City. We will close with a question and answer session. We'll include both questions previously submitted, as well as questions you send us tonight through the question and answer text box. And tonight's session is being recorded and will be posted on our website for you to view later. So, our panelists. My name is Andrea Swenson. I'm the Residency Program Director and have been since 2014. I was a resident here, and I will just say it was sometime this century. That was followed by a neuromuscular fellowship at the University of Illinois at Chicago. And after I graduated, an opportunity arose to come back to Iowa as faculty, and I really jumped at the chance. I enjoy my residency here and really like the idea of getting to work with the UIHC faculty again. And at that time, I was offered the position of Associate Program Director. And after 6 years in that role, I transitioned to Program Director and have really enjoyed building upon an already awesome program, which I just realized is in its 85th year. So we're pretty old. So working alongside our residents has really been one of the most rewarding aspects of my career. And I really look forward to seeing what the future of neurology has in store. Tracy Cho is our Vice Chair for Education, and he is going to be joining us a bit later as his son is finishing up baseball practice. So prior to moving to Iowa, Tracy was on faculty at Harvard and was the program director at MGH. So I really appreciate all his insights on running programs. And he specializes in neuroimmunology and neuroinfectious diseases. So I will let everyone else go around and introduce themselves.
Sure, I can go first. Hello, everyone. Welcome. I'm Aditi. I'm one of the PGY4s and the administrative chief. I went to med school in India, did a couple of years of translational research at Yale, and then came here for residency. And I'm going to Salt Lake City next year for an autoimmune fellowship.
Oh, sorry about that.
And I can go next. Hi, everyone. I'm Ryan Lechtenberg. I'm the scheduling chief this year, but I'm originally from Eastern Iowa, did undergrad near here in Eastern Iowa, and then did med school at the University of Iowa, residency at the University of Iowa, and then I'll also stay around at the University of Iowa as staff for general neurology. And so my theme is not leaving Iowa, and I don't really plan to leave Iowa anytime soon.
I guess I could follow that up. It's a very similar story. My name's Eric Arneson. I'm also a fourth-year resident. I'm the academic chief this year. I'm from Central Iowa initially, had a brief out-of-state experience in Nebraska for my undergraduate training, and then immediately came running back to Iowa for medical school. And I've stuck around for residency. I'm going to be doing a neuroimmunology fellowship like Aditi, but I'm staying at Iowa as well and sticking around for the foreseeable future at this point. So,
and with the theme of staying in Iowa and neuroimmunology, I'll follow Eric. So my name is Lama. I'm one of the neuroimmunology and neuroinfectious diseases faculty here. I actually did my med school in Damascus, Syria. So I'm like Aditi and IMG, then did my residency, neurology residency here at the University of Iowa, did my fellowship here at the University of Iowa as the inaugural fellow. So I work with Dr. Cho very closely. and now starting my first adult job. So I have high interest in academics and in medical education. So when I was offered the role as associate program director and associate clerkship director, I jumped on. I cannot stress enough how much I love it here. As you can tell, I came to Iowa and like the rest of them just stayed here forever. So I like to think of this as my second home and my second family. So we have a lot of the things that attract me here are how everyone is like a family, basically, the warmth, the closeness, and the excellent opportunities that I'm pretty sure we're gonna talk in abundance about. And with that, I'll hand it off to Jeff.
Sure. Hello, everyone. My name is Jeff Karduk. I am originally from Ohio. I did my medical school in Pennsylvania at Penn State, and then I ended up coming to Iowa for residency, which I completed 2 years ago. I ended up doing an epilepsy fellowship at the University of Virginia. So I've been to a bunch of different hospitals in different capacities, but when it came time to looking for a career, I was very interested in coming back to Iowa for many of the same reasons Lamar mentioned. The collegial atmosphere here, the fun we have on service, and the interest in education. So my more academic background is I have a strong interest in education, epilepsy, clinical neurophysiology. I'm hoping to help create epilepsy fellowship here and to add to the didactic experience and bedside teaching of EEG and epilepsy. So I just started back as a faculty a little over a month ago, so I'm just getting started, but I'm excited to be back.
Hey everyone, I am Caroline Martin. I'm the coordinator for the residency program. I've been with the department almost 6 years now. I started out working with our department chair, George Richardson, and I have always really liked education as well as everyone here. And so I had the opportunity to join this team almost a little over 2 years ago. So I've been working with our residents for 2 years, and it has been tons of fun. And I think Dr. Cho hopped on if he wants to say hello to everyone.
Hi, I'm Tracy. I'm realizing that I had a lot more hair when I moved to Iowa and got that photo taken. I moved from Boston to Iowa in 2018, and one of the reasons I came was because of how welcoming and warm the residency and the department were, and I've been thrilled since moving here, and thrilled that we're also growing our education team. So welcome.
Great. All right, thank you. So in preparation for tonight's presentation, I polled the residents about adjectives that come to mind when describing our program. Supportive, educational, and willing to change are common themes that emerged. The residents described our program as welcoming, comfortable, cohesive, diverse, fun, friendly, and positive. We really value diversity, and we're committed to creating a supportive environment. Within our departments, we have an active DEI committee, and this has members from the faculty, residents, nurses, technicians, administrative staff, and we sponsor events that promote discussion, education. Some of these include a lecture series and a book club, and we really provide a support network for all of our staff. Our program has developed Neuro Wellness, which is our resident-focused wellness initiative program. This has been spearheaded by our wellness team of residents and Dima Fatal, who's our head of neurology at the Iowa City VA, and she is an absolute wellness guru. And it's strongly supported by our department chair, George Richardson. So our wellness team has compiled resources for mental and physical health, including facilitating resident access to primary care providers. We're continuing to develop strategies to reduce burnout, finding ways to decompress, and discuss challenging and difficult cases that we might face while we're working in the hospital, and really helping each other achieve that work-life balance. We provide enhanced mentoring at both the faculty and peer level, and have check-ins from leadership. So I meet with residents individually quite frequently to see how things are going. Our program is committed to providing the best education possible, which our residents describe as thorough, data-driven, and high quality. So here at Iowa, we provide our residents with a well-rounded clinical experience, exceptional didactics, and a multitude of research opportunities. We are the only academic medical center in the state of Iowa, so we have a diverse patient population with great cases. And this is not only just bread and butter neurology, but also some very rare disorders. We do rotations at the university. We do have a VA hospital, which is across the street. And we do have rotations that are set up in community practices throughout Iowa that residents can see what that experience is like. Our faculty represent multiple neurology subspecialties, so our residents really get exposure to all aspects of neurology. We have a didactic curriculum that residents participate in every day at noon, except Fridays. And this features pretty much all of our neurology faculty, both clinical and research. And we really utilize resident feedback as well as in-service exam scores to really tailor these didactic sessions to our program's needs. We do have a weekly grand rounds, and that has both internal and external speakers. Throughout the week, there are additional conferences that residents are welcome to attend. These include a neuro-oncology conference, neuro-oncology tumor board, muscle pathology, brain cutting, neuroanatomy labs. So there's a lot happening to supplement residents' clinical encounters. For research opportunities, there are many mentors within our department and within the institution itself to guide residents who are interested in getting involved in scholarly projects. We are a site for StrokeNet and NeuroNext, which are infrastructure grants that allow us to be a site for multiple clinical trials. So for the stroke trials in particular, residents are an integral part of these trials to really get patients enrolled quickly, particularly those who come through the emergency treatment center. And also residents can jump in on any projects from basic research, educational research, as well as research and quality improvement. So as you know, the PGY 1 year is primarily rotations with internal medicine. We also include rotations with psychiatry. Residents rotate with us on our neurology general inpatient service, as well as rotating through our surgical and neuroscience intensive care unit. We have a very strong internal medicine department, and our residents really develop a solid medical knowledge base to build upon. But potentially the best part of that year is the very last rotation, which we call our neurology immersion block. So during this no call, no clinical duties rotation, our PGY 1 residents go through an intro to neurology with a heavy focus on neurological emergencies to really get them ready for being on neurology call. We also do workshops like our lumbar puncture workshops, and also going over things like basic EEG, EMG, simulations like a code stroke, a mock status epilepticus, and also do a lot of team building and shadow calls. It's a really great opportunity for residents to get ready for their PGY 2 year. So yeah, welcome to neurology. You know, PGY 2 is what you've all been waiting for. During this year, our residents get quite familiar with treating neuroemergencies such as acute strokes, status, Guillain-Barré, and taking care of really sick inpatients. But we feel that it's very important to give our residents as early and as much exposure to the different neurology subspecialties as we can that year. We have put together theme weeks where the PGY2 resident can really focus on a particular subspecialty clinic. This really gives our residents an opportunity to see what fellowship opportunities are out there. And we do have some elective time during the PGY2 year, which helps with that as well. The PGY3 year brings about more responsibility for the residents, as they are now the senior on our stroke service, inpatient consults, neurointerventional service, as well as critical care. Also during that year, we have enhanced the leadership roles for our residents. They are our clinical service liaisons, and through those roles, they've developed important, meaningful quality improvement projects that actually produce changes for the better. Mentorship is very important during your training and also throughout your entire career. And as our residents get to their PGY4 year, we're really looking to them as role models, mentors, and really teachers for all of our trainees. During that year is the time to really hone your neurological knowledge and skills and get ready for independent practice. We have creatively designed tracks within our program to enhance residents' educational experience. The Clinical Neuroeducator Training Program, or the CNETP, provides training in the foundations of medical education, as well as educational opportunities with our learners. Residents in this track acquire skills to become effective educators, develop and implement scholarly projects, with goals of becoming future education leaders. The Clinical Neuroscientist Training Program, or CNSTP, is designed for trainees who are interested in pursuing an academic career, who have already demonstrated proficiency in biomedical or clinical research. So this unique program is supported by an NIH grant. It provides close mentorship from leading neuroscientists and clinicians, as well as providing flexible scheduling to balance research and educational goals. So willing to change. Our residents describe our program as receptive, flexible, adaptable, responsive, and collaborative. I want to emphasize this last point, collaborative. Our department and our program has witnessed many, many changes over time. And these changes have really come about with collaboration between faculty and residents. We really value resident feedback and really rely on residents to help us move forward. So every month, Caroline, Jeff, Lama, and I meet with the residents during our house staff meeting. Each month, we have a new agenda and we discuss what's going well, what's not going well, and what needs to change. To highlight a big change from our recent past, I want to talk a bit about our clinical curriculum, which is based on the X+Y model. And this is for the PGY2 through PGY4 years. This has been in place since 2019, and every year has gotten better and better as we've realized what's going well, what's not going well, and made the necessary adjustments. The residents really like it, and I don't see us going back to what we had before, which included residents having their weekly continuity of care clinics every week. So these clinics are extremely important. It's really a time when residents get to know their own set of patients. They develop rapport with them. A patient is calling the resident their primary neurologist, and that's the person they want to talk to when they call into the nurses. So these clinics are great and really important. But when we had them once a week, despite the rotation a resident was on, we found that these were really disruptive to both inpatient duties as well as clinic duties. So we changed it. So X is a certain number of weeks of a specific rotation. So currently our PGY2s have 3 weeks for their X, and the PGY3s and 4s have 4 weeks for their X. And the Y is 1 week of COC clinics as well as subspecialty clinics. And we have found that this has been less disruptive, and it's actually improved the continuity of our COC clinics. It does provide a predictable schedule for planning weekends off, so that's been a nice benefit as well. So this is just a sample of what a Y or COC week might look like. So just take note that we do have clinics at both the university and the VA, and residents really appreciate the different patient populations and what those two clinics look like. To highlight some of our more recent changes, this past year we have created a non-teaching stroke service, which is staffed by advanced practice providers. Starting this service has really reduced the number of patients on the primary stroke service, and in doing so has allowed for more teaching from both faculties and residents. This has been a really positive addition to our program and department. We've developed a senior boot camp, which takes place in the spring as a prep for the PGY2s as they're moving into their senior role, and also as a refresher for the PGY3s as they are continuing to be a senior. Next week, we are holding our first concentrated didactic session. This will be a 2-hour didactic session from 12:30 to 2:30 with lunch provided. It's completely protected from clinical duties, and the focus will be on high yield clinical neurology topics. So our first topic will be our neuroimmunology extravaganza with board review. We're really looking forward to adding these didactic sessions on top of our ongoing daily didactics. So we're continuing to find ways to optimize our clinical curriculum for all post-grad years. We're in the process of overhauling our PGY1 schedule for next year. With feedback from our residents, we recognize that the schedule is a bit lopsided, and for some residents, they have their inpatient months together, and then the outpatient blocks are kind of clumped together. So we will be putting together a schedule that has golden weekends interspersed more consistently throughout the year, and will definitely be much better overall. And our program is continually gating new educational opportunities. Much of this arises from new faculty hires, which is now at 56 new faculty hires since 2010. So we've definitely grown a lot in our department. And our residents really benefit from the experience and expertise that our new faculty members bring. So with that, I'm going to turn it over to our chief residents to talk a bit about what it's like to be a resident in Iowa City.
I can probably go first. Just to give everybody a little bit of a background, I had never come to the Midwest up until my interview here. And one of the big reasons I came to Iowa City, apart from all the illustrious faculty members, of course, was just the people. So I would say life here is not stressful at all. We have all the resources that we would in a bigger city, but everything's extremely reasonable. You never run into traffic. It is quiet, but not so quiet that you ever get bored. So personally, for me, I just got married recently. Me and my fiance at that time, we got a dog. We like to go hiking a lot. We have an excellent library downtown in case you like reading. Iowa City is one of 42 cities worldwide, I believe, for UNESCO's Cities of Literature. The writers' workshop here is famous worldwide. If you like art, we have a lot of galleries here. We have really, really good restaurants from almost every single cuisine. I'm Indian, so I'm very picky about my Indian food, and I have found really good Indian restaurants here. So, and rent is fabulous. I was living in Connecticut before, so my standard of living has definitely gone up. So I think that's probably what I would summarize my life outside of work here as.
Yeah, adding on to what Aditi said, there, despite Iowa City being a fairly small town, there really is a lot to do. Obviously, of big things. So there's a really strong athletic program here at the University of Iowa. The football team is always nationally ranked, and home games are always very exciting. I think upwards of 100,000 people will come into Iowa City and tailgate and go to the game, and it's always a really big fun event to be a part of at least once, even if you're not a sports fan. The basketball team's always very good. There's a lot of events within the university that are around town for sure. And additionally, there's lots of non-university affiliated things to do as well. Like there's a lot of good restaurants. There's also a lot of good breweries around. There's other sports teams. Like I think there's a minor league hockey team that was just established last year. That's pretty fun to go to. There's a big theater where there's like orchestra and musical theater things that come through. And there's a lot of little small towns around Iowa City that I like to go and visit too. There's a little German colony in Amana, which is 20 miles north of here. There's a small Amish community to go visit in southern Iowa, like 10 minutes, 15 minutes south of here. There's great hiking trails. Some are closer within 15 minutes by Lake McBride, where you can do other like outdoorsy activities, kayaking, swimming, boating. Then there's some that are a little farther out. One of my favorites is called Makokata Caves, which is a state park where there's really deep, interesting caves you can explore and hike trails around them. So lots of really both outdoorsy, indoorsy things you can do. It's really overall really balanced, fun city to live in.
Yeah, and I would pretty much echo what Aditi and Eric had said. Some of my favorite things to do in the area is probably go out to eat. The restaurants are surprisingly good in this area, I would say, like Aditi had said. The breweries are also really good, fun to go to, good places to hang out, especially a lot of them have outdoor patios for the summer. But then I'm also a huge Hawkeye fan, living in this area for so long. So going to tailgating on the weekends for the football games or going to the basketball games in the winter are some of the main things I do. But then also in this area, there's really easy access to nearby lakes in the summer. So we like to go boating out on Coralville Lake, which is really only like a 10-minute drive from where I live. Or on the flip side of things, in the winter, you can basically travel like an hour away and there's a really good skiing place. So a lot of different options for outdoors activities. And I would definitely harp on the cost of living as a huge positive in this area. You can really get great apartments, good home options on a resident salary. And I have a wife, a kid, a dog, another kid on the way. So having the ability to actually buy a house with a yard was a huge positive. And kind of like Aditi had said, with traffic and then the low cost of living, it's very low stress living in this area. So those are kind of the main things I would say.
Thanks. I did want to ask some questions that were sent in earlier. So one of the questions was, how do you describe the culture in your program?
Yeah, I think I was going to touch on this one, but I would say the culture is one of our strengths for sure. Just in terms of residents, we all get along really well. Have fun, but we're also a supportive group of each other. Just like when any illnesses or family emergencies pop up, everyone's in general very willing to help out when a resident really needs help. And as scheduling chief, I'm super aware of how people respond to those scenarios because I'm the one that actually has to call them into the hospital. But everyone's always super receptive and understanding. But then also, in relation to attendings too, the residents and attendings here, I feel like have very good relationships. All the attendings love to teach, are really good mentors, and then really do anything they can to help you out with your career goals. But a good example was kind of what Dr. Swenson had touched on with the new didactic sessions, the 2-hour sessions that are blocked off for residents. Is during that time, the residents actually don't have any clinical duties. And so the inpatient services and pagers are actually covered by the attendings just to allow protected learning time. So I think that's a really good example of how supportive our attendings are. And that's something that I'm not sure would happen at a lot of places. And then she kind of touched on too, just how many adjustments have been made to the program, because program leadership is super flexible and really responsive to residents.
One thing I just wanted to add when you mentioned flexible and schedules and covering for one another. As everybody knows, this pandemic has just brought some really interesting challenges our way. And, people have gotten sick and have had to quarantine and take a certain amount of time off. And I was really proud of how the residents put together a policy as far as what our program is going to do when someone is sick, when they have to quarantine, and how we're going to cover for each other. And it was very fair, and everybody agreed upon it. And so it was really nice to see everyone work together to cover each other, particularly during these unbelievable times that we're in. So another question that came through was, please tell us more about the immersion block.
Yeah, I can touch on that. I think Dr. Swenson, you talked about this a bit already, but I think it needs repeating because I think it's really a great strength of our intern year here. So from June to July, towards the end of your intern year, you have no clinical responsibilities. You're not on any rotations where you're seeing patients or having to deal with anything like that. You're solely focused on the transition from internal medicine to neurology, which they're very different things. And there's a lot of different things you need to learn and be ready for when you start as a neurology resident in July. So you get that whole month and you have various different activities to help prepare you for that. You'll get didactics from your senior residents and from faculty in different specialties. And you'll get a lot of practice dealing with a lot of different neurologic emergencies. For example, you'll run multiple mock code strokes because you'll be dealing with a lot of those when you get started. You'll practice treating status epilepticus patients. And then you'll also get some workshops to work on other clinical skills or procedural skills like starting to read EEG or doing a lumbar puncture. And you get all these things scattered throughout the month to really help prepare you for that transition to starting neurology. I'm not sure if too many other programs have something like that, but when I was going through intern year and I had been focusing on medicine for 11 months, it was really nice to have that month to really change gears, focus on what I'd be doing going forward. And it really made the transition a lot less stressful. And I forgot to mention one other part of that transition or part of that immersion block or neuro boot camp, as we like to call it, that makes it really helpful is you have various different shadow calls throughout the month where you'll either on a weekend day for a few hours or on a night call for a few hours, you'll come in and you're not going to be doing a ton of like actual clinical work, but just watching the residents on call and seeing how they react to things, their thought process, and how they go about being neurology residents. I think that combined with all the other activities really made the transition a lot smoother, made me feel a lot more comfortable and at ease, and also kind of helped to start establishing those collegiate relationships with my co-residents who I hadn't really seen a ton over the first 11 months. So I think it's really nice to have that transition time.
Yeah, it's a lot of fun. And it's something that we keep building upon. Every year we get feedback from the residents who just went through it and what we need to change and add, take away. So I think it's getting better every year. Another question, what does wellness look like for your residents?
Yeah, I can take this one. So we have a wellness team with residents in different stages of training. We have faculty mentors. I join in on the meetings from time to time as well. We approach wellness from different aspects, including physical, mental, social, financial, and career. So for mental wellness, as Dr. Swenson had mentioned, we have lectures at noon conference on mental health and burnout. The university makes it really easy for us to have access to the Department of Psychology and Psychiatry as well. Dr. Swenson and the chiefs frequently check in on all the residents to see if there are any issues cropping up, which we then address either on an individual basis or on our monthly house staff meetings. For physical well-being, we're working with the hospital cafeteria on more healthy and vegetarian-friendly options. Our hospital has a gym. There are multiple fitness centers across the city, some of which are affiliated with the university and really affordable. One of them has a lazy river as well, which I think is a really fun feature. We do fitness challenges amongst residents as well sometimes, because it can just be really hard to go to the gym sometimes. So during the pandemic, we had like a push-up challenge where we would do a certain number anytime we would see a new consultant. That just makes it a little bit more fun. For social well-being, we have monthly wellness events, which can range from happy hours to bowling, hiking trips. For this month, we're either going to go on a hike or we're going to go to the orchard, depending on what the consensus amongst residents is. We also have lectures on financial planning, disability insurance, important real-life topics, which I personally didn't really think a lot about until those lectures, and I found them really helpful. And I think another important aspect would be career wellness. So our wellness team is working on setting up a network where residents who are interested in subspecialty training would get to sit down with an attending and maybe a PGY4 who is matched just for an informal meal. And that way, the relatively more junior residents in training can learn more about what a subspecialty involves and career prospects in it before they have to make a choice on what they really want to pursue.
How would you describe the patient demographic you serve?
Yeah, and I can take that one. I would say in general, it's a very wide variety of cases we see in pretty much all areas of neurology. And you would kind of think being in Iowa that it would be a very like white Midwestern population, but with the university here, there's a lot of immigrant populations as well. So it is a very diverse patient population, I would say. And we do also basically have a large encatchment area with all of Iowa and part of surrounding states as well, being the only academic center in the area. But since we cover both the university and the VA, I would say at the university, you get that very diverse population, wide range of cases, more complex cases at times. And then at the VA is more of your older male population a lot of the time, but you also do get a lot of good bread and butter neurology exposure there with things like headaches, tremors, dementia, Parkinson's, things like that. So it's a really good balance and mix, I would say, within those two places. And then also, while I don't forget, there is a cool new mobile free clinic initiative that Tyler Schmidt, one of our PGY3s, is starting with a med student here just to help the underserved population in the area. I think it's really just getting started. So there's a lot more to come, but it's kind of a cool new thing that's being started.
Yeah, I just want to add about the patient population and kind of what we're seeing in Iowa City in particular with our population. It is becoming more diverse, and looking at the numbers from the most recent census compared to the one before, our Black population and Hispanic population have both increased, and we're seeing more of a diverse population, particularly within the Iowa City area, as well as the larger cities within Iowa. So it's definitely a changing demographic as time goes on. Also, are there opportunities to get involved in research?
Yeah, I can maybe take that. So I'm currently working on multiple different projects at the same time. So I recently presented a poster at the AAN Summer Conference on a really cool case we'd seen of West Nile causing opsoclonus myoclonus syndrome. I'm in the process of writing another case. One of my papers is getting published, which described a rare mutation causing leukoencephalopathy, and that's in collaboration with the Department of Pathology. With the Department of Radiology, I'm working on a project studying white matter changes in neurosarcoidosis. And then I also have a project in the EMU with a couple of other residents studying the subjective versus objective duration of seizures in the EMU, and to see if we can differentiate based on which lobe of the brain and the seizures are coming from, and if there's a statistical difference between left-handedness versus right-handedness. We have a number of residents who also do bench research. None of us 3 residents who are on the meeting today do that, but Odeh Haluli, Khan Dennis are both a part of the Aldrich Lab, and their research involves working with mice models. We have almost all of the residents are involved in either a QI project in their PGY3 or a clinical research project, but we do have a lot of opportunities for bench research as well.
All right, so we are looking at a lot of questions that are coming in, and Tracy and Caroline are going to walk us through these.
So I know that Caroline has answered. There have been several questions about application criteria for screening in terms of USMLE score cutoffs, or for international graduates, the year of graduation. And we don't have any firm cutoffs. We're looking for well-qualified applicants from all different backgrounds. So there were several questions in that regard. So hopefully that's clear. We look at the entire application and every angle that we can, and we're looking for well-rounded, motivated folks. Let's see, there was a specific question about, well, there's several questions about the CNSTP. Do you have to be a US resident? Is there a different code in the ERIS for that position? Can it apply during the intern year? And what research opportunities are available? I think we covered that last question already, but so maybe a little bit more about the CNSTP program.
Yeah, I can talk about that. So it is open to US residents and those who are on visas. The only issue would be with funding. I'm not sure if with the NIH funding, if there's some specifics on visas there. But the program itself, we welcome anyone who's interested into the program. And then if we needed to figure out funding, we can do that. But the program itself, we will take anyone interested. And so it's really designed to help residents develop a career as a clinician scientist after their training. And so during residency, they do have time when they can do research. Most of this is going to be elective time. Some of the rotations are a little bit different than residents who are not in the track. But for the core rotations, we keep all of that pretty similar amongst all residents. And we really want to make sure that our residents get the training that they need to become a competent neurologist. And that is first and foremost for all residents, and especially for clinician scientists. You really want to get that solid clinical training in addition to your research interests. And so we do provide some time during neurology training, residency training, with the idea of continuing into fellowship afterwards, where there can be some focus on clinical training, but then also getting more into research during fellowship. It's a really great program for residents with that career goal in mind. It's wonderful leadership and mentorship. The neurologists who are involved in the CNSTP program are all clinician scientists. They've gone through this. They've been able to build their careers with being both clinicians and scientists, running labs and making it work. So they're really good role models for our residents, and just a really, really good program to help kickstart that career.
There was a related question about opportunities for clinical research in addition to basic science. The short answer to that is yes. We have a very strong School of Public Health. We are a core for biostats for the NeuroNext network, which is an NIH-funded collaboration of 25 institutions for doing research on rare diseases. And we have a couple of trials going there, but Iowa is the core site for the biostats for all NeuroNext studies. And so there are, one of the nice things about the being attached to the university so closely is that there's much interaction and collaboration between different graduate colleges and the School of Public Health and the medical school. So lots of opportunities there. There were several questions. Well, there's a couple questions about what is the structure, how are residents evaluated, and what is the structure of the evaluation, formal in writing versus in person?
Yeah, I can discuss about evaluations. So there's a lot, and they're coming from many different angles. We fill out the ACGME milestones for each resident twice a year. And with that, we also review evaluations from each rotation that are submitted through a program called BedHub. So these evaluations go out to faculty members when they complete their service time, and that's on a weekly basis. So at the end of the week, the faculty member gets the evaluation for the resident and fills it out, hopefully. And the residents get to see that, and they get to see who filled out the evaluation. And we also have evaluations coming in from some of our nursing staff. Some of our technicians will fill out evaluations on residents. And we also have patients filling out evaluations during the continuity of care clinic. And so that's a paper form. Patients also get evaluations emailed to them through a program called Press Ganey, which is through the entire institution. And those are specific to each resident. So residents get to see that feedback from patients. Residents meet with their mentors twice a year. So I saw a question pop up about formal mentorship, and every resident is assigned a mentor a faculty mentor before starting residency. I try to match them up with interests. So if there's an area of neurology that they are interested in coming into residency training, I try to match them up with a faculty member in that specialty. And so the residents meet with their faculty members twice a year to go over their evaluations as well as the milestones. We also get information from our clinical competency committee, which is a group of faculty members who meet twice a year to discuss each resident and how they're doing clinically. And that information gets written up, and the resident discusses that with their mentor at the meetings that generally happen in December and June. So there is a lot of formal evaluations that residents get. We do encourage faculty members to give a lot of informal feedback. So at the end of their week on service, we really encourage faculty members to sit down with residents and just give some feedback about how the week went. I think feedback is always most effective when it's given in the moment. And so we try to encourage that too. If a faculty member sees something that happened or wants to give some feedback, to do it right then. So residents are definitely getting a lot in the way of feedback and evaluations.
I would add one thing to what Dr. Swenson mentioned about the mentorship program is that we also have peer mentors. So the residents are paired together. The junior residents, like a PGY1 is paired with a PGY3. So when they become PGY2s, their mentors are PGY4s, and they can walk them through all the walks of life during residency, which I found was super helpful to bring the PGY1s into the fold while they're still like kind of not quite with internal medicine, but not quite yet with neurology. And I would say from my experience as a resident and now as faculty is that mentorship is very organic and flexible, and you're not limited. You have one official mentor just to kind of make sure things don't fall through the cracks, so you get your evaluations done. But we also have a lot of informal mentors, and they're just as protective and really wanting to succeed in your career as your official mentor. So that's one of the strongest things I believe we have in our residency program.
There's one really important question we need to get to before we move on. Are there good coffee roasteries, specialty coffee places in Iowa City? What are some of your favorite coffee places? And I think we should start with the chief residents for this one.
I saw that question. I wondered when you were going to get to that one.
There's two that are, I guess one that's my favorite, Java House. It used to be in the hospital and then unfortunately left the hospital, so it's super disappointing. But that has really good coffee, one of my go-tos. But Bread Garden, who replaced Java House in the hospital and is also in downtown Iowa City, also has good coffee, I would say. It's still not quite living up to my Java House thoughts, but I'll take it for in the hospital.
But there is a Java House in the research building.
I know that's a little bit too far of a walk for me.
It's good for you, Ryan. You should get out more.
I know.
I don't know what you're busy doing that you can't
Work
take
off
a
the
15-minute walk. I have all the time in the world to go get a coffee.
Don't forget about the fancy coffee machine we have now in the resident workroom, unless you guys already broke it.
No. Yeah, we have a Nespresso machine and a Keurig. So, and the department buys us a lot of coffee. So we are never running short of coffee. I think my personal favorite would be depending on what kind of coffee. So if we're talking Vietnamese coffee, I like to go to the Dandelion that's downtown. They have really, really good brunch options too. The best French toast I've ever had. And in Coralville, there is a small place called High Ground. I really like their light roast coffee.
A lot of great suggestions so far. I would also add, if you're willing to go to Solon, which is like 15-20 minutes north, there's a place called Good Vibes. My wife used to teach up there and we go there all the time. It's really, really good. Would highly recommend if you ever get a little bit north, I guess.
We have gone just for the coffee there, Eric.
It's worth the trip. It's really good.
There are several questions about international medical graduates. How many do we have? Do we welcome them? Are there specific requirements in terms of expectations for international medical graduates? Who wants to take this one?
Yeah, I can speak to this. So we really our approach to reviewing applications is very holistic, and we are really looking at all aspects of the application. We do really value diversity and really appreciate perspectives from all over the place, and that's something we really value. So I don't think we look at things differently. We just look to see what people have done and their interest in neurology and how we feel they would fit in our program.
Yep. And as an IMG, I can add to what Dr. Swenson said and just say that from the moment I interviewed at Iowa until now, 4 years later, I have always felt like I've belonged here. I've been given the same opportunities as my friends who are AMGs. We have residents from all over the world. It's a great way to try different kinds of foods too and learn all about different kinds of cultures. But our program is really, really inclusive.
And that's a slightly older IMG. I definitely echo everything that Aditi mentioned. I would add we did Friendsgiving not that long ago. I think was it last year? Everyone brought their own dish from wherever they came from. It was pretty fantastic.
There was one comment that looking at our residents on the website, it's great of how welcoming we are of international medical graduates, but there were only 2 DO physicians in the current classes. How friendly are we historically with DO applicants? I have not been here that long, but I would say we have had an increasing number of DO applicants, and I think it may be a matter of who's been applying to our program as opposed to us specifically including or excluding any particular group. But Andrea, you have a longer history if you want to speak to that question.
Yeah, absolutely. Again, we really approach the applications just sort of looking at everything, not one thing in particular that we're looking at. And we really welcome all people to apply and really appreciate what everyone brings to the table. So I don't feel like we're trying to single one area out, but really being inclusive.
There are several questions about the new supplemental application and signaling, which is new for everyone. If you want to speak to that, Dr. Swenson.
Yes, this is new, and we'll see how it goes. I think we'll keep an eye out for it and sort of see what the preferences are. The way we're approaching this is we will look at that, but again, we're really going to be focusing on the applications and reviewing them holistically. From an applicant perspective, what I've heard is to if you're using those to rank or signal your programs, but it's only 3 signals that you can send out. So I think I'm not I'm going to pay attention to it, but not too much because it's only 3 signals, and we know that there's a lot of programs people are applying to. So I think we're just going to see how it goes. It's something new. It's a pilot. I know other programs, like I believe internal medicine and maybe dermatology, went through it last year, and ENT went through it as well, and really felt like it was helpful. So I guess we'll kind of see how it goes.
There are a couple of related questions about the question about urban versus rural. And I would just emphasize, we want to get the best applicants we can. And it doesn't make any sense for us to exclude people that we would think would be a good fit here. And you never know, after interviews, your preferences may change and the criteria or a characteristic of the program that you think is most valuable might shift. So we recognize that, and I think it's probably going to affect more if there are, if there's a flood of applicants and you have no other way of screening out. But as Dr. Swenson mentioned, we're looking at the entire package, and it's one of many factors. So I don't think you would be penalized by us for indicating, an urban preference. Obviously, we're not an urban place, but we have a lot of cool urban amenities. So, sorry, that was a long answer. bottom line is it's a new thing for neurology, and I wouldn't lose sleep over it. And if you feel like it's important, indicate so. And if not, then I wouldn't worry about it. There's some quick ones maybe. Is there sports neurology opportunities? I'm not aware of any formal ones, but I think there's sports medicine is very big here because of the athletics. Dr. Swinson, do you know of any other specific opportunities or what any prior residents have done in that vein?
Yeah, so we don't have anything specific to sports neurology, but like you mentioned, sports medicine itself is really big here with the University of Iowa teams. And we, with our elective time, we have the ability to be pretty creative with it. So if there an opportunity arose for a resident to work with our sports medicine group, we could easily set that up. But yeah, there's a lot that that they're doing with their group, just not specific to sports neurology.
So we have another question about support residents receive in terms of funding for books, board exam, registration, meals, etc. So we do have an education or book fund for each of our residents. It's $300 per year, and we do support, I'll let Dr. Swenson speak to this more, but we do support conference attendance. All PGY3 residents we pay for them to attend the AAN, and that's separate from the book fund. Meals in the hospital, this is separate from the book fund as well, but each resident receives call money to eat in the hospital. And I'll pass it over to Dr. Swenson to talk a little bit more about travel expenses for conferences.
We really encourage residents to get involved with conferences in any way that they can. So we've had residents submit abstracts and present posters or present at live sessions. And we have a mechanism to allow residents to submit those abstracts and attend those conferences. We do have funding for residents. Sometimes it goes through a resident's mentor on the project. Sometimes it comes out of the department. But we do encourage residents that if that is something they want to get involved in, to really work with us to see what's possible. We do want this to be high quality, so we'll be looking at what the conference is and what the project is and making sure it makes sense for residents to submit an abstract and then go to the conference if accepted. But it's something that we really encourage, and we really want to work with residents and their mentors on making those things possible. I know there was kind of a slowdown on in-person conferences and a lot of things virtual, but that's kind of coming back up now. And there's so many benefits for residents going to in-person conferences, the networking, the getting exposed to the latest and greatest research that's out there. So that's something that we really want to make sure residents have the opportunity to be involved in.
There's a question, is research experience mandatory for selection for interview? This fits into that category of we're looking at the whole application and not just one part. So the short answer is no. If someone has a really strong academic record and strong letters of recommendation and shows passion for neurology, we can definitely help someone get into research who hasn't done it already. If someone has not the academic record they would like, but is very engaged in research and very productive, that definitely will help make up for other gaps in an application, but it's not mandatory. I don't know if anyone wants to add to that. Okay. What years do residents get exposure to neurocritical care and interventional neurology?
I can talk on the schedule a little bit, but you'll get exposure during intern year with 4 weeks in our neuro ICU, which is combined surgical and neurosciences. So you get exposure right away intern year, but then it's kind of a unique ICU where it's an open ICU. So there's the ICU team that handles more of the ICU related things like the ventilator, pressors, things like that. But then a lot of our neuro patients, the stroke service, for example, will follow the stroke service and handle the neurology side of things. And so you get a ton of ICU related exposure on both stroke or when you're on inpatient general neurology for patients in status, Guillain-Barré, myasthenia, things like that, or on the inpatient consult service. So it's very like consistent ICU exposure, I would say, throughout 2nd to 4th year and then 4 weeks intern year. And as far as neurointerventional, we have 3 required weeks during PGY 3 year, but then also with your elective time. There's a lot of elective time with like 6 weeks PGY 2 year, usually anywhere from like 6 to 9 weeks PGY 3, and then more, probably around like 16, 17 weeks PGY 4 year, where you can use that time however you want to. And so you could get more exposure that way.
There's another question about exposure to pediatric patients. One of the chiefs can maybe speak to that.
Yeah, sure. So you rotate through with pediatric neurology for, I believe it's at least a month per year for your 2nd, 3rd, and 4th year. So you get 3 months of pediatric exposure, and it's divided into half of it's clinical, like in clinic, and the other half is inpatient. So you're going to see a very broad spectrum of pediatric cases during that time, from headaches, epilepsy, stroke, anoxic brain injury, status epilepticus, the whole works. Neuroimmunology, you'll see some like ADEM and things like that. You'll really get a broad exposure. That's built into your schedule. So that'll come with for everybody.
One thing about
Go ahead.
One thing about child neuro. So it is a requirement for adult neurology residents to do at least 3 months. And just to kind of highlight some positive changes that we made in the past, our schedule was all 3 months of child neuro were in the PGY 4 year. And so residents really didn't get any child neurology exposure until then. So we moved it out to have a block each year, which has been much nicer for residents to get that earlier exposure.
There is a question, do you have a global neurology track? We don't have a formal track, but many of our residents do rotations abroad. And we have faculty who we have a couple of interventional neurology and stroke faculty who have collaborations with different places around the world, in particular, Dr. Samaniego in Ecuador. And so there are opportunities, but we don't have a formal track. I would say this falls under the concept of a flexible curriculum with a supportive program. If you have the initiative, we have the networking and means to connect you to do those kinds of opportunities. Anyone have other things to add on that topic?
Yeah, we have had residents in the past do abroad rotations, and they've come up with these on their own. And we have a group through our emergency medicine department who just knows how to set up rotations abroad. They have a great system in place, and they're really helpful for us if we have residents who choose to do that. Also, speaking of connections, the one in Ecuador has been a really awesome opportunity. We've had faculty, residents, and students from Ecuador come up and train with us and give lectures, and it's been a really really great exchange. We're also a sister center with Queen Square in London through our hereditary neuropathy clinic. So we do have an opportunity for residents to do a rotation there. We haven't had any residents do that yet. We had a couple medical students go a few years ago, and it was just an awesome experience, but definitely different opportunities, and with the flexibility we have and the support within our department and other departments here, it's definitely possible to set those things up.
There's a question in here, Tracy. I think you could answer this. What formal training do your attendings and staff have on giving feedback in your program or hospital?
Not enough. We're always looking to improve that. So we have, well, first and foremost, we are growing our medical education team, and with that, the culture of teaching. So Dr. Karduk and Dr. Abdel, as well as Dr. Rader, who's not on our panel tonight, are relatively new faculty, but we are building a clinician teacher cohort. And one of the explicit goals of that is to develop such faculty development and workshops. We do have grand rounds every year on medical education, and we have covered this. The hospital also has medical education specialists who give recurring sessions on giving feedback that many of our faculty and our residents have attended. And those are workshops that are hands-on with role playing. But I think it could always be more. I don't know if Dr. Karduk, you attended any of those when you were a resident. Dr. Karduk was one of our very early CNETP residents, so clinical neuroeducator, along with Dr. Abdel. If you,
Yeah,
can you
I can
to
speak
that?
about that briefly. Yeah, so one of the benefits of the clinical neuroeducation training program is you get to attend different seminars that are given by the Office of Consultation and Research in Medical Education. So that's a group here unique to our hospital of people who have a research interest in education and best practices. So these tend to be half-day seminars. The time was protected for me to attend, where you can go on different themes or topics, such as giving written feedback, giving verbal feedback, how to create, I think I attended one on how to create good assessment questions. And it's a unique, because it's people are interested in education from all different realms. So there were plenty of physicians who attended, but then there are also nursing educators, physical therapy educators. So it's an inter-specialty and inter-role collaboration where we all attended and then got to do role-playing scenarios. So I thought it was a really good experience to learn more of the data about giving feedback, and definitely something that I started to incorporate as a fellow and then as a more senior resident as I attended more of these sessions.
Yeah.
The second, so
Oh, sorry.
go ahead.
Speaking of feedback, I think that's the theme of our CNETP quarterly meeting next week.
Yes, preparing some delicious scenarios for the resident to practice their feedback skills during, so it should be fun.
And the second part of that question was about nursing. And as Dr. Kuduk mentioned, a lot of these sessions are not physician specific. And one of the strengths is having a mix. I will just generally comment that the nursing culture here, well, nursing is very strong. at the University of Iowa. It's a magnet designation for nursing quality. There's a nursing school, but the collaborations with not just nursing, but other allied healthcare team members is excellent. And there is always good communication, which leads to feedback. So let's see, is there a system for couples matching into different departments, for example, neurology and pediatrics? There's not a formal program, but I would encourage anyone who's couples matching. We definitely welcome couples matching. And our program is very proactive in reaching out to other specialties when that is the case. And I would encourage anyone who's couples matching to make that very clear to the program you're applying to and ask for any help in networking for the partners or person that you're couples matching with. Dr. Swenson.
Yeah, I just wanted to say that the program directors here from the different specialties, we all are very close. We meet once a month and know each other very well. And when it comes to couples match, we talk a lot about the applicants and making sure we can do what we need to make it happen. But yeah, it's definitely something we talk amongst each other as a group about. We're just a very tight-knit group and really work well together and appreciate each other's help and suggestions in directing a program.
We've got another, do residents have the opportunity to get involved in public health work and or get additional training in public health?
I think this is similar to the earlier question about clinical research. We don't have a specific formal program or track in public health, but as with many of the other questions about different opportunities or tracks, the flexibility of the program, the elective time, and the support for any resident innovation or initiative is a general theme, and the School of Public Health here is very strong. I don't know specific. I know some of our faculty have collaborated with public health. There are certain databases that have been very helpful in looking at different clinical questions in Parkinson's disease, among others, but I don't know if other panelists know of specific collaborations with public health beyond that.
Yeah, I know with the databases, we've had some residents develop projects utilizing those. And there's a group through public health that's always worked very closely with our stroke group. If residents are interested in developing projects, I know there's mentors there who would be very interested in collaborating. So there's definitely opportunity. We don't have like a way to formally get like a master's in public health. I know we've looked at ways for residents to obtain their master's during training in any area, and it is very difficult. It's very intense. We have formed certificates, like a medical education certificate that residents can obtain, which is definitely a lot easier than going for the full master's.
Yeah, I believe sorry, just wanted to add quickly. I believe the School of Public Health, now that I think of it, may offer like quick classes in biostatistics that are like not as intensive as a full master's. But if someone isn't interested in like just honing or sharpen the skills in biostatistics, I think those would be available. You just have to look into the specifics.
Do neuroresidents get to learn central line insertion and other invasive procedures apart from LP? And that's part one of the question.
No,
Oh.
sorry. Go ahead, Dr. Svensson. Okay, I was just going to say I guess it depends on how interested residents are in doing procedures as well. But when we're in the SNCU, we do have the opportunity to do central lines, art lines, and even intubate if that is something you would like to do. EMGs as well. I think Ryan Lechtenberg can talk much more about that. I think he's on his 250th, 260th EMG, Ryan.
Getting
but-
close to my number.
But faculty here are very, very encouraging if anybody wants to do any procedure. For me, it was art lines. But if there's any procedure that you'd be interested in doing, they would definitely be very open to it.
Dr. Sharma, you know neurologists don't consider EMGs invasive procedures. It's just a part of the neuro exam.
That's true. Just like an LP, though.
But definitely hopping on with what Aditi said, with the amount of elective time we have, you can really kind of gear that in any direction you want. And you can really go after a bunch of more of those invasive procedures versus someone more like me. I'm not as interested in ICU related procedures. So after intern year, I haven't really done that, but I've been more interested in EMG with my elective time. So I've done a lot of that, for example.
Even
Go ahead.
I forgot to mention pleural taps and abdominal taps as well. There are lots of opportunities to do that in intern year.
There are a lot of nerves in the gut, and a lot of neurons too. All right, there are several questions about scores and how we triage or filter applications. Dr. Swenson is a saint and basically goes through every application. So we don't have any automatic filters. That there are several questions related to that. If looking to apply to the CNSTP, according to our website, we need to include a letter of recommendation from the supervising scientist. Is that included as one of the 4 letters in ERIS, or is it submitted separately? That's a very specific question, Dr. Swenson.
I would say submit it as part of the 4 letters in ERIS.
Yeah, generally, if an applicant has done enough substantive research to ask for such a letter, it should be part of your application anyway. Is emergency medicine? Sorry.
There was a question, I think the part 2 of an earlier question, I think I.
Oh, thank you.
About
I forgot to answer
neuro-ophthalmology.
that.
Yeah, a couple elective related questions.
I think that goes well with the EM question too, in the sense that I feel like if you want to do an elective in something, you just have to ask. And I think our leadership is really very flexible with working with you to find that elective, whether it's neuro-ophthalmology, which is a great department here, they're world class, or EM, or whatever you want to do. If that's something you want to do, they can make it work for you. So that's what I would say about it.
Yes, absolutely.
I will say you are likely to get plenty of emergency medicine experience in your usual role, seeing strokes and other emergencies in the ER. But if you're looking to expand beyond the typical neurology, for instance, the more neurosurgical aspects, you definitely can, anything that you want to do with your elective, we can help you build. Does anyone see any other questions we haven't addressed in one way or another? Are there any last questions that people want to submit or haven't had answered? There may be some specific questions that come through that we can address offline. So we have gone through, I think, we don't have any hard no-goes on the application. So there was one question I'm not sure I understand. Do you have avenues for organized medicine with the AAN and AMA during residency? I'm not sure I understand the question.
All of our residents are members of the AN. We pay for their membership. And
Oh, maybe membership was what instead of medicine?
maybe,
Yes.
yeah. But yeah, the AN is really a good resource for residents, and we want to make sure our residents are not only members, but any opportunities for residents that come up, we want to make sure our residents get involved. Some examples of that is for the annual meeting. We've had residents get scholarships to attend. We've also had residents be part of the enhanced leadership program at AAN. We've had residents present posters at both scientific sessions as well as quality improvement sessions. And it's really been a great opportunity for our residents to get involved in the greater neurology community. So yeah, we definitely make sure they're involved in AN. And I think we've had some residents go to the ANA conference as well. So those are two really important organizations that we want to make sure our residents are definitely involved in those.
Dr. Swinson, have we had residents do the Neurology on the Hill or the Palatucci advocacy? Okay.
Yes, we have. We've had a couple of residents attend those, and they each time they came back from those, they gave a presentation to the departments about their experience, and it was really interesting to learn about what they did and who they met with and what platform they were working on at the time. And so it's a really good experience for residents. So there's the national one through the AN that the AN organized. There's also a Neurology on the Hill in Iowa too, at the Capitol in Des Moines. So there is an Iowa Neurological Association that I believe all of our faculty and residents are members of. And I think Aditi, you're a leadership, you serve a leadership role in the INA. Yeah, they're another great organization that our residents get involved with.
Yep, and it's really cool. We get to meet every month, and they do have opportunities for residents to present on a local platform as well. So in September, a lot of our residents submitted proposals for presentations, and so we get to meet all the members of the INA. We're going to have like an INA social at a really nice restaurant. It looks really good on our CV. There's a cash honorarium. So it's a good opportunity to learn more about research and build local network as well.
We had a new question come through about childcare in the facility. What are options for residents with kids? I'm looking at Ryan.
Oh, do I have answers for that? So it was childcare costs. That was the main thing, right? Or in the
just
options
options for
and costs.
childcare for residents with kids.
Yeah, and so I'm not for sure if there's anything within the hospital. I think there's a daycare, but it's somewhat hard to get into. But I live in North Liberty area, which is 10-15-minute drive from the hospital. And just right around my house, I think I could probably count like 5 or 6 daycares that are really good quality, all reasonably priced. And then also when I was looking for daycares, if you end up coming here, get a hold of me because I have a very good Word document of a lot of daycares and their pricing, at least as of 1 to 2 years ago. So it might not be super up to date. But there are really a lot of good daycares around here, a lot of different options. And so I don't think you could really go wrong, and you'll find something very close to where you live.
And I will say, as your kids get older, there are a ton of college students happy to do part-time babysitting or drive your kids to 4 soccer practices a week, just as an example. We are at our time. There was one last question that I think might be a good one to end on, if anyone wants to comment on briefly. What quality do you value in an applicant? I will say, when I get this answer during interviews, I want someone who's going to take care of their peers, who loves neurology and is going to try to be the best doctor they can be for their patients. Anyone else want to answer that?
I think that's well said. I would emphasize that I think passion in neurology is really a big part of what I value. And then also, just having good humanistic qualities, relating to people, looking out for people, being someone who I want to work with every day. Those are things I'm looking for.
To add to what Eric said, for me personally, I would like to work with someone who I get along with, especially for a whole week of night float, which is when it's 2 residents. And I've been very fortunate that every single resident I've worked with so far, I've really, really liked. So just the ability to be a good human and help out your co-resident is what I would look for.
Dr. Swenson, any closing remarks?
Yeah, I definitely agree with all that you've said. I think another thing that is helpful is flexibility. I think as physicians, we can't always plan what's going to come our way and have to adapt to the changes. And that's something that I really admire about all of our residents is how they adapt and take whatever happens in stride. And I think that's going to be something that will help them from here on out in their careers. But thank you so much for joining us tonight. We're really excited to kick off the season, and please feel free to reach out to us anytime if you have questions. Our website has a lot of information on there, including how to contact us. So yeah, feel free to reach out anytime.
And we'll post this video on the website too.
Yep.
Thanks for joining, everyone. Nice to see everybody.
Good to see you guys. All right, take care.